Today we have so many wonderful treatments for a disease called atopic dermatitis, or what we call eczema. Now, eczema, what do you think of when you say the word eczema? It's an itchy, red, blistered rash. Starts as early as 6 months of age and can go on into adulthood. It sometimes does not go away. The underlying problem is you don't have to have a rash all the time. You don't have to have the red rash and blisters. You itch day and night. The itch is incessant to the point where not only do the infants become irritable and lose sleep, and the adolescents and the adults, but also the caregivers, the family members who have to take care of these children or teenagers or adults. Nobody sleeps, everybody's grumpy because they all are sleep deprived. That's one of the problems with eczema. You get sleep deprivation. You go to bed, you're warm and toasty, you sweat, you start itching even more. Then you start getting the blisters, the rashes. And as a child, as a baby, it's the face, it's the scalp, it's the neck, it's arms and the legs. And the minute the child can reach the skin, they start itching and scratching, and they get infected. And that's one of the complications of eczema, from the scratching. All right. So eczema is an allergy of the skin. That can be inherited. And what do you see in the family members or the members that have eczema? Family members can have asthma, which involves the lungs, sinusitis, which is a nasal allergy. That's all related to the eczema family. Treatments today can be very, very effective. The treatments that we have used up to now are all topicals. Topical cortisone, which you have to be careful. You can't use long-term because that causes thinning of the skin. And thinning of the skin is not good when you have eczema that is chronic and can be for years. So topical steroids, but we also use other modulators that calm the itching down, calm the skin down, but not as effectively as something new today called Dupixent. Dupixent is a wonderful medication, approved for 6 years and up. And what does it do? It gets rid of the itching within 2 weeks. Within 2 weeks, patients will come in and sit down and say, I'm not itching anymore. And a lot of these patients also have asthma, which is part of the allergic family. So when they sit down and tell me, I'm not itching anymore, the other thing they say is, I can breathe, I'm not wheezing, I feel so much better and healthier. And that's the point of these new medications like Dupixent. There's so much research that's going on in atopic dermatitis or eczema. Safe, effective treatments so we are not scratching all day long. Eczema, what other things can it cause? As I said, infections, inflammation, viral infections because you've got cracked open skin, and you can also get something called allergic contact dermatitis. So when the skin is cracked and open and irritated, chemicals can go into the skin and cause allergies. So now the eczema is getting worse because you're getting allergic to things that you are putting on your skin. What things are really a problem in patients with eczema or atopic dermatitis? Fragrances, so anything that has perfume in it, scented, wool, lanolin, which is in most moisturizers, it's an emollient, and dyes. So any dyed products can give you reactions. Watch those things. The important thing is to use emollients. Try to hydrate the skin and use emollient moisturizers that contain shea butter, mineral oil, petrolatum, because those are non-fragrance, non-irritating, non-allergenic products in moisturizing vehicles and bases. If you can moisturize twice a day, use mild, gentle soaps. We used to recommend cleansers. We don't do that as much anymore because there's so many active ingredients in cleansers. We now recommend more like a Dove for sensitive skin, which has only a few chemicals in it. Eczema today can be cleared effectively, safely. Dupixent, as I said, is safe for 6 years and up. And the results are almost miraculous because it changes people's quality of life. The burden of these diseases on the patients who have them, on the family members who take care of them, is large. And so we always recommend giving you safe, effective treatments that work quickly. So you're not suffering, because you've already suffered for so long before you've come in to see us for our diagnosis. So see our skin experts at Trillium Creek Dermatology for quick, effective, and very safe treatments if you suffer from eczema or any kind of contact allergic dermatitis. Thank you.